Kia ora, I'm Dr Keith Abbott, GP Advisor to the Southern PHO and GP here in Dunedin. Audit tools can help general practices improve care for patients and maximise funding. They act as safety nets to find patients who fall through the gaps, taking away all that hard work to identify those who need seen the most. That's because they automatically run queries and retrieve data from your practice management system for you. If you want to identify eligible patients overdue for a cardiovascular risk assessment or with important data missing from their medical records, like smoking status, an audit tool is ideal. You can then contact them via text, phone or mail and invite them to come in for a risk assessment or ask them whether or not they do smoke. When choosing an audit tool, consider how user-friendly you find it and whether it allows you to review previous audits to track progress. It's also useful if the financial impact of missing information is shown. I find this a real motivator. Southern PHO is currently sponsoring practices who wish to adopt Dr Info as part of a cardiovascular risk assessment project. It allows practices who use the tool to monitor their progress in terms of eligible patients and target achieved. It can also run a range of queries to help practices with accurate coding. For example, it can find patients who have been prescribed smoking cessation medication but have not had their smoking status recorded. Practices can also monitor their performance against other practices using this audit tool. Within the bulk CVD tab, general practices identify eligible patients who have all the required data in their electronic health record to have their cardiovascular risk assessed. With the click of a button, they can generate a list of patients that can be virtually assessed for cardiovascular disease. This is known as a non-face-to-face cardiovascular risk assessment. The tool also auto-inserts the risk percentage into the right patient record in their patient management system. As part of the project, Southern PHO is providing vouchers for general practices to send to patients who have been virtually assessed as having a risk above 10%. These vouchers offer free face-to-face assessment covered by the PHO. We are also encouraging practices to review the clinical CVD tab to see which of their patients who have had a cardiovascular event have not had their blood pressure measured in the last 12 months. These are people who need monitoring and should be recalled to discuss their treatment plans regularly. We have had great success with Dr Info. In the past 3 months, half of the practices in the Southern PHO have been using the tool. We've noticed a huge increase in the number of cardiovascular risk assessments being done, which must correlate to improved patient care.